We're talking about destination motherhood, giving moms to be important information to make the new parenthood process go as smoothly as possible. Dr. Jessica Nash is from Children's National Health System. She joins us this morning. Welcome.
Thank you for having me.
So I know there's a big summit coming up in DC, but why the push to really reach those moms to be and those new moms?
So we know that infant mortality in the United States is high compared to other developed countries. And this is an important topic because the health of infants and the health of mothers is important. And we know that in order to, improve the health outcomes of moms and babies, then we really need to push this to the forefront for all parties involved.
And what better way to get started than the nation's capital, right?
Exactly.
Well, you look at a mom gets the news that she's pregnant or she's, they're either starting a family or a second or third baby. It's so overwhelming. But I think the important thing is for moms and families to know is that there are resources there, and you guys are kind of helping it bring it all together. You're creating that team for moms.
Yes, and I mean, there's a lot of resources, and oftentimes people don't know where to turn to. One of the great resources you could go to is just your pediatrician and ask for help. Often moms don't realize the other resources in their communities, breastfeeding support, pediatrician support, doula support, and so they're all out there, and we just want moms to know where these support systems are.
And so Destination Motherhood, what is your goal? What are you guys hoping to reach, and what areas of motherhood and moms to be are you hoping to attract to?
So we want to promote health of the environment for moms before they have their baby. So we're talking about safe sleep for babies, the improvement of health for mothers with immunizations and making sure that they're seeking prenatal care. But this even goes beyond just having the baby. So knowing that they have to have patience and practice and perseverance when they're having a new baby at home.
And they need to get some sleep too.
And they definitely need to get some sleep as much as they can.
When you see new moms, what's kind of one of the biggest and most common concerns that you have to address as a pediatrician?
So I think one of the biggest things is feeding. So everyone wants their baby fed. We know that's the important things that babies do. And really just making sure that they are comfortable and that they have all the resources. The other important thing for pediatricians is safe sleep. So making sure that their babies have, a safe sleep space. Oftentimes moms go out and buy all these new gadgets, and really the most important thing is really just a safe place for the baby to sleep.
I was watching something last night. It was parents-to-be, and they were starting to get a little nervous, right? And they were going over the list of foods that you can't give to babies, and so I know that it can be just overwhelming because you have this new human in your life that you want to protect. And when it comes to like food and where can they go to get the information of really to kind of calm their fears a little bit?
So there's a lot of educational resources in the community. I mean, one of the first places they could go is to their pediatrician's office, or if they don't know one, this is a great time to start looking for one, because one of the first places a baby needs to go after they're born and left the hospital is their pediatrician's office. But there are a lot of support centers in the community, so like Mama Toto's Village, Children's National Health System. There's a lot of lactation support centers in the area. So those are great resources. So regardless if they're breastfeeding or formula feeding their baby, this is great information for moms to have before they even have their child.
All right, and when a mom does have a child, what have you noticed when it comes to the mom's mental health afterwards?
So we're always concerned about moms and how they're doing. There's a lot of anxiety, a lot of pressure, and with the lack of sleep, we know one of the things that can happen is postpartum depression and anxiety. And we like to talk to moms about this even before they have their baby, because it could start early, but definitely after moms have their baby. And so we know one of the first places that moms are going is their pediatrician's office. And so this is a great conversation for them to have with their pediatrician, but also their family. So their spouses,
right,
their grandparents, and everyone involved can be supportive of the family. And there are great mental health resources in the community that we like to send moms to.
I didn't realize, you always hear about postpartum depression once the baby's born, but you said it can start well before the baby is born.
So some people have risk factors for postpartum depression that we can even see before the baby is born. So if there's already some concern for mental health, if there's a lot of social stressors going on, you can see some of this before the baby is born. But definitely after the baby is born, we are concerned.
I know as women, we want to take control and take control of our own bodies, but this takes a village. It's a family.
It is.
Right?
And a lot of people think that it's them or it's something wrong and they should be feeling this way. But this happens to a lot of moms. And once we take that stigma out of it and people feel open to access resources, I think it's helpful for everyone.
Absolutely.